Well, what we're seeing in some of the countries now is giving booster shots to their health workers, especially those who received the Sinovac. Well, we're seeing this in Indonesia. Huh? So are we seriously considering similar moves in our country, at least for health workers, Mona, frontliners?
Yeah, for now, for now, we are not recommending any booster for even for the healthcare workers. No, the 2 dose Sinovac, Pfizer, or the other brands is enough at this point in time. And our priority is really to vaccinate majority rather than giving the booster to a few and enhancing the immunity. So it's very important, especially for NCR, no? The A2 and the A3. If you look at data, there's only less than 50% of this population. And these are the highly vulnerable. When the Delta variant comes in and you have increase in transmission, these are the same people that will be going to the hospital, and that can overwhelm our healthcare facility.
Yeah, but Doc, I mean, are you concerned? And I guess more to the point, what can we do? What can you do? What can all of society do to head off another surge, not in the virus, but another surge in vaccine hesitancy? Gaya ng nabanggit ni Ami, Indonesia is now talking about not just a booster shot for frontliners, but a booster shot of Moderna specifically, and not Sinovac, which they had used. And if reports are to be believed coming out of Thailand, that was precisely the concern of officials in Thailand. Na pagka lumabas yung balita na Moderna ang booster shots, what might the optics be in terms of, people saying, yung Sinovac pala, walang ano, even though that is not the intent. We have to stress that that's not the intent. But the optics of it and the message of it, are you concerned that might heighten vaccine hesitancy again, particularly with Sinovac?
That's the reason why that when we look at data now, especially in our country, in the Philippines, what is the rate of breakthrough infections among healthcare workers? And I would presume our breakthrough infection is really low compared to Indonesia or even Thailand. Okay, and that's why our recommendation is still we are good with the 2-dose Sinovac, and we will wait for the data to come in, the overall rate of the breakthrough infection. And again, as I've mentioned, we'll come to that once we really see that we need a booster. But for now, I think it's not there's no indication yet to give boosters, especially for the healthcare workers.
But isn't it true that the vaccines still continue to be effective against severe COVID and against hospitalization for COVID? I mean, how true are those reports going around? Are they founded in science and scientific data so far?
Yes, Luchi. No, in fact, the Indonesian data, even in the Thailand data, the protection, especially against hospitalized COVID, is still very high, more than 90%, even with the Sinovac. No? So I'm still confident that for us to be protected, and the more important endpoint with this vaccine is that nobody should be hospitalized, nobody should develop severe infection as long as you're getting these vaccines. Over that, when you get the mild symptoms.
So give us the numbers, yung A2 and A3 na hindi pa bakunado. Yun yung mga vulnerable, di ba? So pagpalagay na natin na X% of that ang makakuha ng Delta at ma-hospital, what kind of overwhelming numbers are we seeing here?
Let's just an example, no? So for example, if the A2, no, the 60 years old and above, let's say it's 10 million, and out of the 10 million, only 2 million are vaccinated. Okay, so that's more or less 20%. Okay, you have 8 million highly vulnerable. That when they get the infection, higher risk for them. And you look at an 8 million. Risk for hospitalization, risk for mortality. That's too much.
Now, in the meantime,
Doc, I'm looking at a news story, a Reuters story coming from Jakarta yesterday. 114 doctors died from July 1 to 17, the highest number for any period of similar length. In a country where 95% or 94% of the health workers have already been vaccinated, what should we know about, how do we contextualize this? Is there anything that we're missing here?
That's the reason why, in each of these countries, there are what we call technical working group that will really review and evaluate what's the breakthrough infection, what's the benefit of the current vaccination. And every now and then, that's what we're doing here in the Department of Health in the vaccine expert panel. For now, we cannot just compare ourselves with any of these countries because they have a different way, they have a different data, and we don't have those data on hand. If we have those data that 114 doctors are dead and they were vaccinated, developed severe COVID, then probably we have to review our vaccination recommendations for the healthcare workers.